think that a way that other area hospitals can look at St. Luke's and try and see what the benefits to our program of a program like ours would be in their own setting is that we are looking at the patient and the genomic profile before the patient has maybe started therapy or when they're in the middle of therapy and looking for next option. A lot of times right now, I know that providers and pharmacists are kind of reviewing these results independently, and they're not coming together as a whole multidisciplinary board to review the findings and put those plans into action. So I think kind of reviewing them earlier, and then also the whole multidisciplinary team coming together and coming up with a step-by-step plan to help the patients and to really put together what's next. I think having that all laid out by the team is very, very beneficial.
I always encourage other, outside providers to think about precision oncology, and if it's applicable, what our center can do for their patients. We are happy to see patients once and provide a recommendation and send them back with that, or help co-manage depending on what providers need. But it's really difficult, I think, in the community practice setting, which I've been a part of, to pay attention and track all of the data, that goes along with these genomic results. And so sometimes it's helpful. It takes a little bit off your plate to be able to get another set of eyes on these really comprehensive and complicated results for patients.
Pathologists have to always be on the lookout for what's new and what they needed to learn. So we are continuously being students, looking into ways to improve our ability to take care of patients. There is always new tests, new drugs, and we here in St. Luke take pride in the fact that we are considering ourselves leaders in providing opportunities for not just our patients, but for other pathologists and physicians in the community that can see us as leaders that would help them in providing similar services to improve their practices.
I think St. Luke's is a good model to kind of pick up from. We have, we're kind of in the middle grade as far as our size of cancer center. We don't have the huge robustness of multiple oncologists in every single disease state and multiple pharmacists covered in every single disease state. But we also have a wide range of oncologists treating both solid tumor and malignant heme. And so in our precision oncology, we are really able to tailor. And so using kind of a pharmacist-led genomics program like this, and then to be able to bring those recommendations back to the providers and let them discuss the data that we found, I think might be an opportunity for some of these potential other cancer centers to kind of take a little bit of that off the oncologist.
I think St. Luke's could do a lot for other community cancer programs. We ourselves are a community cancer program, and we really were very grassroots. So we had a physician champion who was very much an advocate for pharmacy involvement. And so we kind of built this program with very limited resources. We had one day that we would do all of the patient workups, have our patient meetings, do all of the follow-ups. Anything that needed to happen happened on that one day, which was really just kind of a project day. And since then, we've grown it to a half FTE for a pharmacist with support for the precision program. So I think that that's really helped us expand kind of the program and the pharmacist role in there as well.
The goals I hope to achieve through these collaborations is to help push science forward. I do believe that in the next 30 years, we will be able to cure cancer. We are already curing a lot of cancers, but I think this is just the surface. I think over the next few years, every year we will have more and more treatments which are directed towards the genomic findings in the cancer. And I think through mine and all the investigators in the world, their efforts, we are pushing the envelope forward every day, and we are hoping to get closer to curing all cancers for every single patient in the world.